I'm Blake Schwank with Colorado Computer Support, and one of the companies we do a lot of work with is PrivaPlan, and with their owner David Ginsberg, and they do security risk assessments for our clients. So we used to do our own security risk assessments, but we decided that that it's like a bookkeeper doing their own auditing. We'd like to have an outside company doing our auditing, which I think David would agree with. That's a better way to do it, to keep an eye on us and to keep an eye on what our techs are doing. So David, thanks for joining us. Can you tell us a little bit about PrivaPlan and what is PrivaPlan and what do you guys do?
Thanks, Blake. Well, PrivaPlan is the longest standing HIPAA privacy and security and breach consulting firm. We make that claim with some evidence, and that's because we've been around since before the HIPAA privacy rule went into effect. And we focus on HIPAA privacy assessments, compliance, HIPAA security, risk analyses, if you said, HIPAA breach notification, and training, education, policy and procedure development, and everything related to that. And we come to it from a uniquely care and healthcare operational background. So we think that helps us amplify as well as apply to the healthcare environment.
Great. And so we've worked together on several projects and several clients. And how does that relationship work for you? I mean, what does that benefit our clients that you're keeping an eye on us? And what do they get out of your security risk assessments to help them out for the next year or two?
I think it helps our mutual clients extremely well. First of all, to know that there's no conflict or issues between you guys as their managed service provider and us as their external reviewer or auditor. Everybody's polling in the same direction to be sure that they're going to be compliant and support them. I think it also provides a more rapid and accurate risk analysis when we work closely with the managed services provider, as obviously your company, so that we're able to get those nuanced questions answered accurately. Of course, in your role managing their networks and managing their infrastructure, it really does help to be able to talk to you around that with regards to that. And I think it also your clients and our clients some comfort to know that between both organizations, we're looking at the same end, which is security improvement, risk management. And it helps them know that somebody's been looking at Colorado Computer Support and Colorado Computer Support's been looking at PrivaPlan to sort of cross-check the findings as well.
Yeah. Well, and we really appreciate it too, because what you end up turning over to our clients, because you're not working for us, you turn over sometimes it seems like it's a 400-page document to our clients. But what we love about it is we can then take that, export it out into a nice spreadsheet so that we can work on the strategic planning, because there's always gaps, whether it's from budget issues or changes to policies. There's always something that needs to be worked on. And what you hand over to them is great for us, because it gives us a little bit extra emphasis when we're telling them that they need to do or suggesting that they need to do something. And we just take that out then and build it into a spreadsheet with high risk items that gets added to next quarter's or over a year strategic plan. And when you identify high risk items, we like to put them on a strategic plan to start working on them, because most of our clients can't solve them immediately. Do those have to be solved immediately, or does it help that we actually have them on a strategic plan and are going to work on them maybe next quarter or fourth quarter of the year? Is that okay?
Yes, in fact, probably the correct answer is they must be put onto some kind of risk management plan. In terms of the time frame, there is flexibility because it's situational. Are there budget constraints? Are other organizational priorities that have to be taken care of, and so forth? Obviously, everybody has limited budgets, limited resources, and so forth. So clearly, it would be a matter of determining what the risk is, having the dialogue like we often do when we're debriefing both you and the client on the results, and coming up with a reasonable plan that will address the strategic issue in a meaningful way and with documentation to demonstrate that risk management is being done.
Okay, no, that's great feedback. Okay, so now we're 2 years into the pandemic, and 2 years ago we all scrambled to secure telehealth, to implement telehealth in a lot of the rural hospitals that we work with, and you did some great presentations on the risk. What do you see as the future of telehealth for rural hospitals? Is it going to expand, or are we going to go back to pre-pandemic levels?
So what I'm about to say is not true for urban hospitals and their clinics. I think it is for rural. I think we're going to see a shrinkage in some areas based upon the rural population and an expansion in other areas. So for example, I think remote telemonitoring of diagnostic devices on patients will only increase and become more prevalent. So the patients who often have to drive long distances don't have to do so. But I don't think the clinics or the hospital visits are going to reduce. I think they will start to creep back up to their pre-pandemic level. But again, I'm not sure that that's going to be as true in the urban environments. And it may not be as true in the younger population, but we're still dealing with of the younger population. So if keep leaving going to urban areas, they're going to see more telehealth going up in those urban.
Yeah, and in 2020, you did a presentation on enforcement discretion, right? That
Yes.
loosened up or that reduced the risk for implementing telehealth. Is that still in place, and does it absolve us of all risk of turning on a Zoom meeting between a provider and a patient?
It does not absolve you of all, but the enforcement discretion is still in place as long as the COVID pandemic public health emergency is in, and it was recently renewed to still be a national public health order that's in effect for a period of time by the Secretary of the Department of Health and Human Services. So until that is expired, the enforcement discretion remains in place. But remember, enforcement discretion is simply that. That means the HHS has discretion. It doesn't mean that if you violate, you're going to be absolved of all concerns. So using it in an unsecured telehealth platform is still a HIPAA violation, but it means that there is some enforcement discretion until emergency declared over.
Oh, so it's not a free for all. We cannot be, if we're negligent, we can still be in trouble. So
yeah, and I would just personally think that 2 years into this, any health organization that has not implemented a compliant, fully secure health platform with a vendor from whom they get a business associate agreement signed is really rolling the dice in terms of enforcement and HIPAA compliance.
okay, no, that's great information. And so moving on to where we are now with kind of getting back to HIPAA compliance, are there any big changes over the last year that your clients have had to implement versus previous years?
Say the biggest change from a technical perspective is the increase in recognition of how important multi-factor authentication is as identity and access management tool. And this has been driven less by HIPAA, Department of Health and Human Services, and more by the cyber liability insurance carriers, who are now looking at that as a required basic security layer in order for them to provide insurance to an individual organization.
Oh, that's interesting. Yeah, one of the challenges that larger organizations have is whether or not employees want to use or will use their personal phones. So we really need to find a way around that, which you can do with key fobs and a few other things to address it. So there are ways around it. They just cost more than having your employee use their personal phone. So
true.
Oh, it's great. And And so is that the highest priority thing that you're seeing that you would have practices implement now, or aside from the rule changes, given the full risk landscape that's out there, what do you think practices should be implementing now if they don't have it?
I would say the multi-factor authentication is right up there as one of the highest items. And then the second, Blake, would be good vendor and business associate management. That is still not done very effectively by hospitals or practices across the country to ensure that they are vetting their vendors who are business associates, that they are on an annual basis looking at those same vendors to ensure their risk posture has not gone down. And then more importantly than any of that, we find is people just, or organizations just don't seem to be following up when you have a vendor that's terminated to ensure that all of the PHI has been destroyed or returned to you.
Yeah, it's really interesting. We're helping one of our hospitals go through an EHR migration. So from their main EHR to another main EHR, and going through all of those vendors, and it's amazing the vendor creep that's out there. And all of a sudden we have 100 tunnels that need to be made and 100 vendors that need to be vetted to make sure they still need access. And that's got to be a huge challenge for practices to go through. And do you go through all those outside vendors that need access when you're doing a security risk assessment?
We want to, first of all, get a inventory or list, and that tells us a lot. We won't do the vetting because often that is very expensive and too outside the scope of just a risk analysis. We'll find out if vetting is being done. Okay. And if not, we'll mark that as a area for improvement. We'll provide guidance about how to actually do the vetting.
Yeah, I can see, because oftentimes we see that they don't get rid of old employees. So I imagine vendors are even harder than keeping track of ex-employees. So, okay. What about the future? What's coming up over the next year or two that we need to be aware of from a strategic planning standpoint, so that, you know, we've got some budget set aside or man hours set aside to get implemented or to make a pivot over the next couple of years? Anything in your crystal ball that's coming up?
Well, I just think organizations are going to feel the challenge to create more and more environments or posture where they are interacting with their patients electronically and using secure electronic channels like FHIR, HL7 FHIR, and application program interfaces between a patient's personal device and the hospital or the clinic's EHR. I think that will present challenges, Blake, that even the vendors can't provide. That will be a training challenge, if you will, for many practices.
Yeah, just because people want access now from every device, right? And
that's right.
Whether it's a provider or a patient. It's so interesting you mentioned patients, because a lot of times we don't, we have no control over what the patient is using, right? And so, and once something's out in the wild, it can be, sent anywhere. So, okay. So we've talked a lot about healthcare because that's where your world primarily is. Do these apply to other industries? Do you deal with other industries, or should other, things like multi-factor authentication, does that also help out construction or bookkeeping or something like that?
100%. Of course, as we've seen from many of these big national newsworthy cyber attacks, like the Colonial Pipeline that occurred in 2021, et cetera, these apply to every industry and not healthcare specific in any way, shape, or form. So I would say we're only at the beginning of this emerging, ongoing cyber threat environment, and it's only going to get more sophisticated as the criminals themselves get more clever and learn better ways of being able to extract money from people or extract reputational harm, create reputational harm rather.
Yeah. Well, and I just did a video on the 49ers. Have you heard what actually happened there? Yeah.
No,
I don't think it's out there yet, but um, what about, are you seeing managed detection and response out there as a hot button? It's not a requirement at this point, is it?
it's not a requirement, but we sure are suggesting it, Blake, as
Uh-huh.
a best practice, because who's got the time to do it in your own organization
Right.
and
Yeah.
or
And
the expertise?
we just rolled it out to one of our largest clients because, I mean, to have that would stop almost, the biggest threats that are out there because it's
That's
watching the traffic between devices.
exactly.
And that's how these things spread. They hit one device and then they encrypt the rest of the network. So,
Yeah.
and man, when your network's encrypted and people want to go attack hospitals and medical practices, right?
Well, and I would think even for your mid-sized medical practices who might want to choke when you come to them with a managed response price, my point is you can't afford not to have it anymore.
Yeah. Yeah. Well, there was a 3,000 employee medical facility where they got encrypted. And I was chatting with their CIO, and they ended up after the fact putting in managed detection and response, and they were more than happy to spend. I forget what it was, but I think it was about $10 an employee a month to put that in, 10 or $15 an employee a month, which is it's a big number when you have 3,000 people. But they were more than happy to do it, knowing what happened to them before. And then it actually did stop an attack 6 months later. And then they realized that it paid for itself because I don't recall how long they were down, but they got hit pretty hard. So, okay.
Hey, Blake, I do actually have another conference in
Okay.
a couple minutes here. I just wanted to FYI that I'm going
No,
to have to end and jump and go to.
we'll close up because I know we're going to be talking because you have a security risk assessment coming up that you're going to do for us to audit
Yep.
us. So if someone needs a security risk assessment, wants to talk healthcare security, what is the name of your company? How do they find you?
PrivaPlan, and it's PrivaPlan.com. Very simple, PRIVAPLAN.com. And the company's actually formerly called PrivaPlan Associates. And probably the best way would be to do and or simply shoot us a phone call at area code 505-466-1432.
That's
We're
great.
a real company with real people answering the phones.
And where all do you do? We know you from several of our clients in Colorado. Where else do you work?
We are national. We have staff in California, Oregon, Washington, in Georgia, in Nebraska, Colorado, New Mexico, and a few other states. We're pretty much national and have full national coverage. And also Texas.
Right. Well, great. And we cannot recommend them highly enough. We love working with David and his team, and
Thank you, Blake.
and everybody we introduce them to likes them. So, so thank you very much for the time. And
Thank you.
again, I'm Blake Schwank with Colorado Computer Support. You can find us at www.coloradosupport.com or 719-439-0599.